Okay, now you have been married for years, some 2 years, 3 years, 4 years, 5 years, some 10 years, and you are still not able to conceive. And sometimes you'll be thinking that you have a problem. Most of the times, women don't really have problem. What we need is lifestyle modification. There are things we just need to put into place. There are things we just need to, modify, and things will get better. It's not all about, taking medication, doing this or doing that. There are things we need to look into. Our lifestyle needs to be monitored and modified. In this video, I will be telling you reasons why you are not getting pregnant. I will tell you about 8 reasons why you are not getting pregnant. If you're coming across my channel for the first time, I'm Nurse Prudence. I'm a registered nurse, a midwife, and a family planning provider. My channel focuses on everything about health. Ask me any question in the comment section. I'll be right there to answer you. Peace. Number 1 is that you are not having sex on your fertile window. Many times people think that they know their cycle, their menstrual cycle, their ovulation, and their fertile days. But when you have an interaction with them, you will notice that they don't even know it. Now, the worst of it all now is that there are lots of apps on the internet. I don't want to mention anyone. People are not using app. They'll tell you, I'm using app is, telling me the cycle. Some will tell you that the app, is always telling them when they're supposed to menstruate, ovulate, this and that. Have you forgotten that the information you give the app is what the app will interpret and give you back? The app doesn't have your information. It is the information you give the app that you typed in that app is going to interpret and give it back to you. So if in any way you made a mistake in your calculation or whatever the date and whatever, meaning that the information that the app is going to interpret will also be wrong. Some of you, I'm telling you, some of you don't really know your cycle. You don't know when you're ovulating. You don't know when you are fertile. Some don't even want to learn. You think you know it. You don't know it. I have had encounter with so many people. When you ask some questions, it will be obvious to me that some people doesn't even know what it means to be fertile. And the word fertile window, they don't even know what it means. So you are not having sex, you are not knacking on the appropriate days. That is one of the reasons you are not getting pregnant. Now, the second reason is long working hours. You work for 18 hours, some work for 20 hours, especially men. Then when you come back from work, you'll be tired. We have only 24 hours in a day. So when you have worked for 16 hours, 18 hours, you will now come back home trying to fix 1 or 2 things to eat and whatever. And before you know it, you are sleeping. You slept off. It's not something, getting pregnant is not a magic thing. It's not magic. These things are practical something. So you need to bring that down for yourself. You need to give it time. The third is stress. Let me tell you, once the body is on stress, let me tell you, it will stop producing estrogen and progesterone. And it is only these sex hormones that will make you to ovulate and even menstruate. So when you're not ovulating, my dear, there's no how you will get pregnant. Pregnancy is as a result of release of an egg. So when you are stressed, the body will no longer have option than to stop the production of estrogen and progesterone and now start producing cortisol, which is the stress hormone. It is the same brain that is working. It is the same brain that is producing estrogen and progesterone that will still produce the cortisol. So when you're on stress, it will just look for a way to balance things up for itself. And the The way is to stop the production of estrogen and progesterone and start producing the cortisol, because it is the same hypothalamus and anterior pituitary gland that will still do the work. They cannot serve two masters at the same time. No, they have to choose one, and the one they will choose is the one that is higher, which is the stress. Reduce your stress. Reduce your stress. The fourth reason is that some of you are not even ovulating. I have a video on how you should know whether if you're ovulating or not. Because how can you, when you don't know your cycle, how will you know if you're ovulating or not? Some of you will be still counting something else while they have already ovulated. You don't even know when you ovulate. You don't even have an idea. And you think you know it, they don't know it. Just, I would suggest you just calm down, learn it. Learn it. Don't presume or feel somehow if I tell this person that I don't know how to calculate my cycle, the person will feel maybe I don't know it or whatever. No, don't feel ashamed. All you need to do is to bend down and learn it. Whether you're using app or not, the information you give the app is what the app will interpret and give back to you. So when you don't know it, just know it well that the information that the app is going to interpret will be wrong. I have about 3 apps. I know why I'm trying to use them to know actually what people are passing through. If you don't know these things, how are you going to be able to interpret the app? You're the one to take the app when your menses have started. You're the one to take the app if you're feeling pain. You're the one to take the app if you're having nausea or vomiting. The app doesn't know all these things. You are the person that are going to tell the app all these things, and the app will interpret it and give it back to you. Don't see the app as Jesus Christ. No, it's like a computer, garbage in, garbage out. Whatever you have given, that is what you will receive. If you don't know it, if you're not sure, like you're not confident enough with your cycle and everything, don't go using app. I know what I'm saying. Some of you have infection. Let me tell you, when you have infection, to conceive is very difficult. I always tell people, when you're having difficulty conceiving, the first thing you will do is to treat the infection. If your doctor have told you that infection is the reason why you are not conceiving, my dear, relax, treat the infection, and you will be fine. The next reason why you are not conceiving is breast discharge. We call it hyperprolactinemia. I know a couple, the woman had this issue. She was lactating. It was the husband that caused it because their own foreplay, the husband likes sucking the breast. So what happened is that the woman started lactating to the extent that the high level of prolactin inhibited the production of estrogen and progesterone, and that woman was not ovulating at all. She had no problem, but they were looking for a child for years, not knowing that the issue was caused by them unknowingly. So many a times it's just lack of information. What you don't even know is what is causing the problem. You need to find out, you need to know yourself, then can be able to know how to tackle your infertility. Secondly is miscalculation. Sometimes you will be calculating something else and your body has already reached to a level. I have said it time without number. Miscalculation. Some of you will be like, my menses is delayed, is that, it's coming late, 2 days late, 3 days late, or 4 days late. Not knowing that you miscalculated it. Miscalculation is a very big issue in terms of conceiving. I'm telling you, if you don't know it, please look for someone that will teach you. I can be of help. Yes. The next reason why you are not getting pregnant is what we call lifestyle. The first one is alcohol and smoking. Avoid alcohol, avoid smoking. I'm telling you, avoid these two things. Then the next is what diet. What do you eat? When trying to conceive, you need to be on diets. Leave processed foods. All this burger, pizza, ice cream, leave those foods. Put yourself on diet, fruits and vegetables. They will go a long way to boost your fertility level and things will be okay for you. Mind what goes into your mouth, mind what you eat. The next is weight. Reduce your weight, especially people with PCOS, polycystic ovarian syndrome. Reduce your weight. Reduce your weight. Weight gain reduces the amount of estrogen and progesterone produced by the brain. Reduce your weight. I'm not saying you should go, trying to fast, No. Mind what you eat. That will help you to reduce your weight. Do exercise. Mind exercise. You can do yoga exercise. That will help you. Some of us have issue with the thyroid hormone. So hyperthyroidism, you need to do the test to know if you have issue with your thyroid. Very, very important. So all these things are the reason why you are not getting pregnant. And the last but not the least is hormonal imbalance. Hormonal imbalance. Very, very important. You need to know the level of your hormones, if they are balanced or not, and treat yourself accordingly. Hormonal imbalance. When the hormones are not balanced, definitely ovulation will be ceased. And there will be no conception, no fertilization, no pregnancy. Know yourself and monitor yourself.